Welcome. You're tuned in to Resilience Radio, building wellness in Vermont and beyond. This is episode 2 with Melissa Marks, medical massage therapist. I'm Irvin Eisenberg. I'm an occupational therapist and a structural integrator and your show host. The opinions on this show are not necessarily shared by me or Resilience OT. I like to showcase a variety of healthcare practitioners, and not every healthcare practitioner really suits everybody's needs. Additionally, the show is not meant to be medically prescriptive or diagnostic, and you really should seek your own healthcare practitioner before making any health decisions. My guest today is Melissa Marks. She's a board certified therapeutic massage therapist, clinical orthopedic manual therapist, and a New York licensed massage therapist. It's worth noting that Vermont does not have licensure or certification for massage therapists. It's good to have you on today, Melissa.
Thank you. Thank you so much. I'm honored to be here.
Let's start off with the listeners getting to know you a little better. Could you tell us a little bit about your hobbies and your passions?
Yeah. So as a Vermonter, I'm a hiker and I'm a skier. I think those are my two favorite things in my life right now. My husband and I live in Roxbury, Vermont. We have a house on about 10 acres. So we're lucky because we have woods all around us and we love nature and we're into permaculture. Um, I think that's pretty much me in a nutshell. I'm very active. I have a slight addiction to Pilates. um, yeah, I live an active, wonderful, happy life right now. I can't complain, despite all the stuff that's going on in the world.
Okay, well, could you tell us a little bit about your background as a massage therapist and what led you to do what you do?
Yeah, so without sounding too cliche, I came into massage therapy because of an injury I had back in 2006. I used to work on a horse farm, so I had a very active and kind of imbalanced job. It was 6 days a week and it was very hard labor. And unfortunately, I was diagnosed with a bulging disc and I had sciatic pain for about a year. And I couldn't bend over, lift hay bales, groom horses very well. Riding miraculously felt good, but it was everything else that did not feel good. Driving in the car was bad. And so I tried at that time in my life, I was not into massage therapy. I didn't know anything about complementary alternative medicine by any means. I didn't grow up in a family that had that. And so I kind of I tried as much as I could. I tried PT, I tried chiropractic, I tried acupuncture. And believe it or not, it wasn't until I tried a massage therapist until I felt relief from the pain that I was experiencing. And it was profound. It was literally like night and day, overnight relief. And I thought to myself, why had I never experienced this before? Why did it take me so long to find out about massage? And I honestly can't remember who told me about this woman, but she was a private practice massage therapist in Ancrumdale, New York. And I just went to see her and she worked out of her home and she changed my life, literally. And so I thought, this is so profound that I really feel I need to share this somehow. But however, because I was a farmer and I didn't work in a social atmosphere, I was very concerned about working with people because I had such a solitary job working with animals. And so what I did was I decided to go to equine massage school. And I started out as an equine massage therapist working on horses. And then as soon as I was certified in that modality, New York State, this was in New York State at the time, decided that they passed a law saying that if you wanted to be an equine massage therapist, you had to be a vet tech as well. And it was a new law that they had just passed as soon as I got certified. And I thought to myself, okay, I don't really want to go back to school to become a vet tech because all of the vet techs that I had talked to said it was pretty difficult and not very fun. And it was just something that didn't interest me. So I thought, well, why not try going back to school for massage therapy on people? And I was like, oh boy, I haven't been to school in over 10 years. And I thought, well, why not just give it a shot? So I enrolled in one class, anatomy and physiology, at the local community college that had a pretty decent, in my opinion, associate's program for massage therapy. And you had to go for 2 years. But I thought, okay, I haven't been in school for so long, but why not try one class? I tried one class and I just fell in love with it. And from that day forward, I decided to enroll. And I kind of did part time because I still had my job working on the horse farm, and it took me a long time to get through the program. I think it took me 4.5 years to get through a 2 year program. I'm sure you understand that. So it took a while, but I finally made it through. And throughout that whole time period, I kept receiving massage from all sorts of people. I tried so many different modalities. And that was kind of it in a nutshell. I was changed for life. And here I am today.
So I've talked with you before, and you were mentioning that you wish everyone was aware of what lies beneath the skin. Why is that important?
Ooh. Oh, lots of cool things. So I think it's wonderful to be able to see the three-dimensional structures of the body. I think it allows for a deeper understanding of our bodies. From a musculoskeletal point of view, it would be so cool if we all could understand how muscles move and how they react to pressure, how they create function, how they react to dysfunction, and how your lifestyle impacts your body. Not to mention all the organs and your blood flow. I just think it would be really cool if people had more understanding of how your body is miraculously working and how everything is jam packed underneath your skin, just brilliantly functioning in this way. And even if you could just follow some of your food through your digestive system, if we had invisible skin, I think it would be a really educational experience for folks that aren't too aware of what's going on inside the body. I've had some wonderful experiences in cadaver labs that have allowed me to touch and dissect and feel and push and pull structures of the body that have changed how my work is and have given me such a deeper understanding of muscles and tendons and ligaments and everything else. But mainly from my perspective, it was for musculoskeletal stuff. So I think it's wonderful that I understand a lot of people get grossed out by anatomy, but I think it's fascinating. And if we all could see that, we might treat ourselves a little bit differently in how we live.
So I know there's a lot of different kinds of massage out there, and you specialize in medical and orthopedic massage. How does that differ from other massage?
Well, medical massage, I just define as having the ability to bill medically. So any massage therapist can do this. You just have to have the know-how to fill out a Claim 1500 form and cross your T's, dot your I's. So that's basically what I define as medical massage. Orthopedic massage, I focus on soft tissue injury. That's the heart and soul of my work. So a lot of injuries, a lot of surgeries, working with people that have had prosthesis, chronic pain, of course. So it's just a little bit different in the fact that mostly I'm working with injuries and musculoskeletal pathologies.
So you do some work with workers' comp and as well. Could you speak a little bit to the types of situations that you might be doing workers' comp claims and how someone might know that it's worth getting a massage when they're dealing with their
Yeah, well, I love
workers' compensation issues?
yeah. So thankfully, I have a connection with an occupational group, occupational therapist group, and some physical therapists and chiropractors in our community who refer patients to me that have been injured on the job, which is workers' compensation, and also motor vehicle accident cases. And their insurance companies reimburse me for massage therapy. So they get a referral from their practitioner, and then their practitioner usually contacts me and says, "Hey, we have this client." And then once I get that referral, they usually contact me and we set up some sessions. So it's no money out of their pocket. And I don't really know how people would find out about that unless their doctors are telling them. So I don't really have the power, other than what I advertise on my website, to inform people of massage therapy being reimbursed. Just word of mouth, I think. And hopefully their doctors will tell them when they have an accident that they can get massage therapy covered, as well as acupuncture and chiropractic too.
So we have a lot of different massage therapists in the area. Less so with COVID now, but what do you feel makes your practice unique?
Well, probably the fact that I do medical billing, because I don't think a lot of people do. I wish more people would, because it's really not that difficult. It is a little time consuming to get to know the proper way to fill things out, and you do have to wait for reimbursement, and you do have to make phone calls occasionally to different insurance companies and even doctors. Um, I think that's probably what most sets me apart. I'm sure my clients have a different opinion on what sets me apart, because as you know, you have to connect with the person you're receiving from. And I know that I have some people that I go to because I love them, and people go to other people because they love them. So it's probably personality as well. You have to get along with the person you're receiving the body work from. Otherwise, you don't feel like you're healing. It doesn't feel comfortable and safe. So that's probably part of it too. Um, I just, I don't know. I don't want to sound anyway broad, but I think that probably my biggest difference is my love for working with really hard cases. I love working with the people that have tried everything else and they can't figure out what is going on. Of course, I can't guarantee that I'll be able to figure it out either, but I think that my experience with my own injuries and the training that I've had is extremely helpful in my knowledge base to be able to help try and figure out and maybe translate some stuff that some of the things that they've been told by doctors that they don't really understand. Hopefully I can help explain that to folks and give them a little bit of peace of mind.
So we've talked about the insurance billing a little bit. I wanted to just make sure for the listeners to be able to know what is and is not covered. Um, It sounds like that car accidents, workers' compensation claims. Is there any other circumstances in which someone might be able to bill their insurance?
Yeah, some people have what's called a health savings account from an employer, which will cover massage therapy and chiropractic and PT and I think some other things. I'm not actually sure because I don't have that myself. Usually those are from bigger corporations. They give you a certain amount of money per year. And so you can use those accounts to cover massage. Sometimes they're a little picky. Sometimes you have to get a receipt from a massage therapist or an invoice of some kind. They usually don't require a Claim 1500 form. They just want to see proof of service, date, and time, and all that stuff. Um, but, and I did have another case that I'm not sure how it worked, but she had her insurance company pay me directly. And I honestly can't remember how she did that, but I was impressed. I think it's important for people to know that please do call and ask your insurance company, because I'm a firm believer that if the more people call and ask, maybe someday we can get this to change. And wouldn't it be wonderful if massage therapy was covered across the board under all massage, or excuse me, all insurance companies? That would be amazing. I'm not sure if it'll happen in our state, but it's not going to stop me from telling people to ask.
I know within the massage world in Vermont, there's a little bit of controversy as to whether or not Vermont should have licensure for massage therapy. I touched on that earlier. Where do you
Yeah.
stand on that? Do you have any strong opinions on that?
I do have strong opinions, and I'll just let your listeners know that they did just pass a bill through, and it was signed by the governor. So starting in 2021, I think it's the spring of 2021, massage therapists will have to register as massage therapists now. So there is mandatory registration. It's not licensure, but it is a way that the state will be able to know that you're out there. And it is a way for the state to say, okay, you did something very, very wrong. We're taking your registration away. So it's a start. I think they're going to charge a fee and then maybe a renewal fee every couple years. But I, coming from a state that was licensed, it's such a different experience in New York because you go through massage school and it's like expected. When you graduate, you take the licensing exam. Not only do you have to pass the massage therapy program, but you also have to pass the state board. So I think because I went to school in New York, it was a given. And it's hard for me to understand the controversy in our state because I didn't come from that. But I also understand that there's a lot of people that don't want to be told how to practice. And that's totally understandable.
Well, thank you so much for joining us today. Do you have any parting advice or thoughts for listeners?
Oh boy. I think that everybody should try massage therapy. If they have not tried massage therapy ever in their life, just pick someone that you know from someone else that you've heard about and try it. It's a wonderful, wonderful thing for your health and well being, especially now in the times that we're living in. Not only just for stress relief, but for muscle function and health. And you will feel your body in ways that you haven't felt it before. And it's so relaxing and wonderful. I think I'll leave it at that.
Melissa is such a humble massage therapist and such a strong advocate for massage and health and wellness and healers in general. She has her own unique niche working with medical massage, but also seems to strongly value all the other modalities of massage and just wants everyone to be able to find the right practitioner for them. It was really great talking with her, and I hope you enjoyed the interview. If you did, share it with a friend. And if you wanted to help me out, you could subscribe to the podcast and maybe leave a 5-star review. You've been listening to Resilience Radio. I hope you've enjoyed.